Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome a remarkable guest, Katie Kristofic. Katie is the founder of the Carefullist. Welcome, Katie. How are you?
Thank you for having me. I'm well, thank you. How are you?
Wonderful, wonderful. It's our pleasure. The Carefullist. Let's start there, and then we'll go in a little bit about your story. What exactly is the Carefullist? How do you describe that to people?
That's a great question. Thank you for asking it. So the Carefullist is an online resource that provides tips and tools to the caregiving community.
Okay. Now, is it for professional caregivers, family caregivers, both? Or who's really the benefiting audience of the Carefullist?
Sure. So it is mainly for family caregivers, those without healthcare experience. However, there is certainly information there for everyone, and professional healthcare providers are certainly welcome to share Carefullist tips and tools with their patients.
So what's the story or the background for creating the Carefullist?
My mom had Alzheimer's, and so my father and my sister were her primary caregivers, and I live several hours away, and I wanted to be able to help. And the way for me to do that effectively was to be the person who does the research and the networking and to find resources for them. And during that process, I realized it was much harder to find information and far more time consuming than I had ever imagined. And as I was looking for things, I kept thinking, I can't believe there isn't a tool or a resource that pulls all this information together. That has to be somewhere. And it turns out it didn't exist.
Right.
And so I decided that I would be the one to try and make that happen.
Well, and you have over 20 years of marketing and communications and, a professional world. What was, everybody wants to do something, everybody wants to help, they want to give back. But I mean, you're kind of taking on this huge entity and saying, I want to have this resource for everyone out there who went through something like my family and I had gone through. That's a big commitment. Like what led you to take it to that level where you want this global resource and, destination for family caregivers rather than just maybe, volunteering at a senior center or, starting a Facebook group or something like that? Like what drove your passion to really take it to that extent? I mean, leaving a career of over 20 years, I'm sure is not easy. And it's a big commitment. There's a lot of unknowns, right?
Yeah.
What drove that, passion of yours?
Sure. So it was incremental over time.
Okay.
My career started in the medical book and healthcare space. And basically, I had wanted to be a doctor. Turns out that I do not have the math and science background sufficient for that. So I channeled my interests to where I do have skills, which is the marketing, communications, and sales space. So I moved into pharma, and the company that I had worked for specializes in making medications easier for people to take. And that was sort of a light bulb moment for me that, there's this entire industry that is dedicated toward making people better and helping people. But sometimes things are missed in the patient experience. And so what they do is technology that is for making medication easier to take for people who can't swallow and things like that. So fast forward to COVID, I was the crisis communications person for that particular company during that time. And as I was contributing to communication through the pandemic and helping people have good information and helping to keep people safe and make good decisions, um, it really became apparent to me that I needed to do something like that. Going back to some sort of a regular job just wasn't going to be enough for me. So it continued to light that fire.
What were your coworkers like when you started sharing this? Hey, I got an idea, kind of thing, and now the idea has come to fruition, which is all the more credit to your commitment and dedication to supporting family caregivers. What was some of the feedback from some of the early conversations you had with either family or coworkers or whoever it was? What was that like?
It was a long time coming. So I had this idea and it was percolating for a long time that it was one of those things, it was never the right time. Um, and then I've been reading a lot and I stumbled upon a phrase that really stuck with me. And it says, if not me, then who? If not now, then when? And so I started talking with folks about it and saying, I've been thinking about this. Do you know of anything? Maybe I just haven't found it. Would you find it useful? And the resounding response was, haven't seen anything like that. It would be great because I don't know where to go for things. I don't know what terms to use to search for things. The general population who doesn't have a healthcare background doesn't know that the term you're looking for clothing that's easy to put on with snaps or magnets or anything like that is adaptive clothing. It takes a lot of research to find out what you're looking for, and then you find stuff. Right. But it takes time, and caregivers just don't have that kind of time.
Yeah. So as you're sharing this idea and you're mulling it over in your head and, you're getting a lot of positive feedback, I haven't heard of anything like this, et cetera. When did you decide to really, okay, this is it. I'm going to go forward with it. Was it during those conversations or did you still have to because I'm looking at it from, I'm assuming, you have a family, you have benefits, everything's probably pretty good. And now you're kind of walking the plank and taking that dive, hoping you're going to swim when you hit the water. When did you decide, what, I am going for it, full speed ahead?
Yeah. So 2023, I kind of got 3 significant shoves in that direction.
Okay.
So the very beginning of 2023, I had been working for a biotech startup. And as anybody who knows anything about startups, it's a dicey endeavor. A lot of them don't succeed. And it happened to be one of them. So I was laid off in January of 2023. So I slowly started making progress on the Carefullist project while I was looking for another job and trying to figure out how were we going to do this. So I found another job and I started in, April timeframe. And so I was slowly making some progress, but the job was more of a commitment than I had anticipated. So I had to kind of put the Carefullist on the back burner. And in September of 2023, my mom passed. Mm. And so that point, I thought, okay, this would be a great way for me to remember her and honor her. And people grieve differently. Huh. And I needed a place to channel all of that energy and all of the emotions and the fire and everything that goes with it. So that really kind of pushed me to start moving forward a little bit faster. And then there was a restructure at the agency where I was working, and my position was eliminated just a few weeks after my mom had passed. So it was at that time where I was like, you read books about people and their life stories, and you kind of see these series of events that happen. And I thought, okay, well, I've lost a job twice in 1 year. and my mom has passed, this is kind of like rock bottom. And this is the best possible time.
Okay.
If I'm going to do it, now is the time. My kids aren't grown, but they're not babies. So they have taken a good interest in what I'm trying to do. So they have a little bit of ownership over it. We talk about it as a family and what it is we're doing and what we want to give to the community, and not just our local community, but the human community. And we're just excited that Carefullist is making the progress that it is. And we're very excited for all the things that are to come.
And that's exciting. I mean, I guess this would be a good time for full disclosure. We're also a brand ambassador of the Carefullist, which was just recently announced, and we're excited to support, the journey and help out in any way that we can. But now that the website was launched about a week ago, have you gotten any feedback from anyone or anything come to you that you were surprised by or that's been extra encouraging that maybe you hadn't expected?
Yes, as a matter of fact. I am continually surprised by how much people keep to themselves when they're caregivers or when they're dealing with grief. I mean, it is a very private thing. But I just keep seeing it more and more that people don't talk about it, and you don't know what people are going through. You really don't. And people that I know, and I know pretty well, have come forward and sent me messages saying, actually, my family's dealing with this, or they've referred some friends who they know are, looking for resources and needing support. So it's been encouraging in that way, that it seems like it's resonating with folks and they're starting to find it useful. I think launching the website kind of helped gel it for people. We had launched on social just to kind of get some feedback from the general audience about what types of content they're looking for and things like that. So that really informed a lot of what we included on the website. Okay. And we will continue to use social in that way, in addition to just building a supportive community of caregivers and folks who are grieving.
So for people that might be listening to this or even watching, describe kind of what the website entails currently, because it's going to be an evolving process and, it's going to continue to grow and evolve. What's on there currently and what are you most proud of at this moment?
Oh, thank you. That's a really good question. So what's on the site, we'll start there, is you have a couple of buckets of information. One is a general caregiving resources section, and that includes caregiving books, podcasts, websites. It's really a tool that you can find lots of good information in one place. And then there is a grief section, which also has books and podcasts and websites, but that's tailored for folks who are grieving. And you can go there and get an idea of what types of help are there for you, and go to those sites or order those books wherever the links may take you. There's our general about us story, so you can read about my family's personal journey with my mom's Alzheimer's diagnosis. And in terms of what I'm most proud of, I would say, this is probably going to sound silly, but there's a story here. The logo. I really love our logo. And the reason for that is because it's an homage to my mom. So the color that you see, the color I'm wearing, my mom wore it all the time. And it also happens to be sort of in the same family of colors that they use for Alzheimer's awareness. But the real reason for the colors, because this is something she wore a lot. And for the V that you see under the Carefullist name, it's white vines. My mom really loved to arrange flowers. She was really good at it. So we chose vines for that. And then because they form a V, there's actually a twofold reason for that. One is her name is Vicky.
Okay.
So it's just, showing her name. And then the other is a little bit more functional. And because it makes that V, it's really showing a funnel. And that's how the Carefullist is funneling all of the information that it finds on the internet down and making it really distilled, easy to find information. So, yeah, that's probably the thing I'm most proud of, because it's very subtle,
Yeah. And then
but it's
deeper.
got a lot of meaning.
Yeah, no, that's perfect. So Katie, let's say a family caregiver is listening or watching this right now, and they go to the Carefullist. Everybody's always worried about things being vetted and being trustworthy and reliable. How does the team and you at Carefullist, how do you guys determine what gets added to the site and what may not get added? Like, what's your barometer for that?
Sure. So my initial education and background is communications and journalism. And in journalism, we have the rule of three. So 3 sources, 3 confirmations that, yes, this is good. Yes, this is right. So that's what we strive for
Okay.
at Carefullist. And, we are just starting out. So we have a small team, which is why you may not see as many resources as you think you would like, just here at the outset. But as we grow, that is something that we will continue to abide by. And we think that it's extremely important because we live in a time where it can be difficult to know what information you're getting is right and accurate and what you need. So we will be using that rule of three throughout the Carefullist duration and providing vetted, carefully, trustworthy information for folks.
Well, now I want to ask the flip side of that question. Let's say there's a company or a healthcare professional or a brand that's listening or watching this. How would they go about reaching out or applying to be listed on the Carefullist?
Sure. They can reach us in a couple of different ways. We do have a form on the website, the Contact Us form, that you can complete, or you can reach out on our social media handles. And we also have an email address that's listed on the site. It's info@carefullist.com.
info@carefullist.com. Okay, perfect. Now, you had mentioned earlier, and I like it, and all's our really dear friends of ours is All's Authors, and one of the things that I'm always bragging about is how they're all about dementia, right? Alzheimer's, Lewy body, frontal temporal, early onset. They take all of these books that the authors have written, and they're all broken up into categories. So you're not having to just go page by page trying to find a book that may apply to your current situation. You'd mentioned on the Carefullist that you have things kind of broken down by category as well. And I know the site's only been launched just at the time of this interview's about a week old. And believe me, I mean, you're always going to be adding to it, changing it, rearranging it. But I'm assuming the categories will always pretty much remain. If anything else, you'll add more categories as you go. What are the categories you guys are currently offering?
Sure. So currently, we started with Alzheimer's because that's what we know. And there are 16 million caregivers for folks with dementia. So that's where we started. But we also have resources available for folks who are dealing with cancer and Parkinson's. There are some resources for ALS, and the list is continuing to grow.
Okay.
Our next phase, or what we're looking at, is for people with multiple sclerosis.
Okay.
MS.
Okay. What is the one thing right now that has surprised you that maybe you didn't expect leading up to this?
The one thing that has surprised me. Sorry.
Okay. We can go back to it later. That's okay. One of the things, that you had mentioned in our conversations and, we're aware of is that, there has been a lot of recent news coverage about the number of unpaid family caregivers in the United States, even
Yes.
globally. You have an interesting statistic, though, related to that. What is that statistic?
Yeah. So in my research for where we can help folks the most, um, I discovered that on average, caregivers provide or take rather a minimum of 13 hours every month to do research on products and on the disease or the situation itself for the person that they are taking care of. And now that data is actually from 2011. So general understanding is that it's probably quite
Sure.
a bit more than 13 hours a month. And as you and I both know, caregivers do not have that kind of time.
Right.
So they need something that's reliable and easy to use, and they can get what they need quickly and keep moving. And that's what we're really aiming to do.
Yeah, that's wonderful. You know, is there any common misconceptions or assumptions that healthcare workers make about family caregivers?
Yes, there are a couple. So the first, and I think the most widespread, is and this isn't an indictment of healthcare workers. They do yeoman's work.
Right.
But when it's your day in and day out, I think it's easy to forget that not everyone has the training that you have or the experience that you have. So anybody who has been with someone who's had a procedure or they've been in the hospital and they're being sent home, you get this litany of instructions. You have to do this, and this is how you take care of the wound or the port or whatever it is. And it makes sense at the time when people are explaining it to you, but you get home and you're tired and you're trying to get your person settled. And then it's time to do the thing. And you go, oh man, I don't remember exactly what they said.
Right.
So I think there's a gap there in understanding on the side of the folks who are taking care of people at home, and then assumptions made or rapid fire instruction made on the side of healthcare employees. And the other big discrepancy for me that I've noticed personally when we would go into any type of a medical setting with my mom is the number of people who don't understand dementia.
Yeah.
My mom couldn't talk and she didn't know her name. And she was in the hospital, and a number of employees would come in, whether they were physical therapists or nurses' aides, whomever. Uh, Part of their job is to ask the name. And we would stand there and say, she's not going to be able to answer you. She can't say it. But they would continue to ask her.
Hmm.
And so there is also a lack of understanding, true understanding of what dementia is and what it is like for folks who have it.
Yeah, I agree wholeheartedly with that. You'd mentioned, was it your brother and sister that lived far away from mom, or was it you that lived far away from mom?
Me.
That's what I thought. And so how was that long distance caregiving for you? I mean, you just mentioned when you said we would tell them, did you eventually have to go out to where your mom was living and stay a while, or were you doing a lot of back and forth trips?
Thankfully, it was 2 hours, so it's doable for a back and forth
Okay.
on occasion. My sister lived close and helped a lot.
Okay.
So I would participate as I could. But that's why I really started taking on the research part of it. I
Mhm.
thought, well, I'm not there as often as I, would be if I lived closer. What part of the burden can I relieve? And as I was doing that, I realized I could lift this burden not just for my family, but for other people,
Right.
you know, certainly by making it easier, but also by letting people know that if you don't live close by, you can help your family who does live close by doing this piece of the load for them.
Yeah, absolutely. Yeah, I tell families all the time in my professional life, brother who lives a state away or 10 states away, it's not that he can't help. There are other ways he can help. He can help, read the lab results, get the doctor reports, talk to the doctors, make appointments, order the groceries, the prescriptions. He might not be able to be there day in and day out, and sadly sometimes, and it's easy to say that from the outside, right? But sometimes it causes some resentment between the siblings where one feels like it's all being dumped on them. But people can't really help where they end up living at and when these things happen, right? Did you and your sister have a pretty cordial time? Oh, that's good.
We did. We are really fortunate that we are very different people, but it actually helps a lot because, the way she approaches things and the way I approach things complement one another quite well. And so it was sort of a natural divide and conquer. And my brother stepped in where needed as well. So it was, for our particular case, it went just fine. But I know that is probably more the exception rather than the rule.
I think statistically that is correct. It is unfortunately the exception rather than the rule. What's the feedback your brother and sister and your family has given you now that the Carefullist has been launched?
Well, they're excited, and they're happy that this is a really great way to honor our mom. He was very, very selfless person. He delighted in doing things for others, and that's really the way that we were raised. Okay. So my siblings are both teachers and active in their communities. My dad was a teacher. He's now retired. So a lot of our upbringing was just that way. But honoring her is certainly something that they're excited about. And they've all contributed to this project as well. My dad and I particularly talked about, there's a resource on the site that is the caregiving assistant, and it has a list of things to think about when you become a new caregiver, or if you're someone who's trying to help a caregiver. One of the things that you run into a lot is people want to help you as a caregiver and they want to know what to do. And then you're like, oh, there's so much that needs to be done. I don't even know what to tell you. It's just easier if I do it myself. So rather than that, having that document and looking at it and saying, I could pick up groceries for you, or I swing by that grocery store or that pharmacy every Wednesday at 6:00 in the evening. What do you need me to pick up for you? Or, just picking something up that anybody needs anytime and dropping it off, kind of thing.
What are some of the plans, or do you have an end goal in sight for the Carefullist, or is this going to be something that's always going to be, I'm sure it's going to always be growing, but do you see an end marker for it? Like where you want it to be at the end of the day when you say, we've done it, we're good, it's done. Is there such a thing?
I don't know if there's a done, but there are phases and there are goals. So there are things that I would certainly like to see Carefullist morph into and be able to accomplish and serve people better. I do have some thoughts and some plans for how we can serve communities. And so it's certainly a national service, but caregiving is very personal, and a lot of what you need and what you do is in your local community. It's the doctors and the visiting angels and, home care and hospice and all of that is right where you live. So we want to be able to expand into making it easier for folks to find out what those resources are, where they are. So we're looking at that as a next phase. And if we can get to that, I will be very, very happy, because that's actually what the goal of the Carefullist was when I first started thinking of it, because that's where we were. Right. We couldn't find hairdressers to come to the house to cut my mom's hair. We couldn't find a seamstress who could alter her clothing for us. We found one eventually, but it took time to make it easier to be able to dress her and things like that. And in every community, There are folks who cut hair. There
Right.
are folks who know how to alter clothing. And if we can connect all of those people, um, number one, it's going to uplift small business.
So would that be like
And
another category, kind of like, personal hygiene or personal needs or something?
right, personal care.
Yeah.
Yep.
Okay. That's one. And you want to find that for every major city across the country, or just in your state, or?
If you plug in a zip code, you can find what's near you. That's the ultimate end goal.
So for people watching or listening, what is kind of, maybe it's not a model of an existing site necessarily, but how would you explain kind of your vision compared to an existing site, probably in another sector or industry altogether? Are you looking for like an
Sure.
Angie's List or like a Google just for caregivers, or?
I think it's kind of a hybrid of
Yeah,
those things.
sure.
And then I would certainly sprinkle in consumer reports
Yeah.
and, the good housekeeping seal of approval so that it comes back around to that trusted, vetted, we have really looked at this and this is why we're recommending it. Dare I say, like an Oprah's favorite things.
No, I think that makes sense. And it builds, for, just even for branding purposes and for, trusted, integrity, having that stamp of approval from the Carefullist, the family will then know, okay, this is a safe, product or service or company. I think that's a great idea. Obviously, this is just the beginning, very, very beginning. I think, was the site launched on Friday, the 8th?
Wednesday, June 5th was the official launch.
June 5th. Okay. So where do you want, and we're going to have a lot of stuff up on the screen and in the show notes for viewers and listeners. But what action do you want our audiences to take now that know about the Carefullist? What can they do to help, and where would you like them to go?
Sure. I would love for the audience to fill out the contact us form or email us with any resources or products that you found that work really well for you, that have been very helpful to you, that we don't already have on the site and you think would be good. And we will take a look and, have our professionals that we've been talking with also take a look. And if it's something that we can get behind, we will certainly share with the broader audience. That would be fantastic.
And I would also tell them to go visit thecarefullist.com and also to follow you on social media, which is all under Carefullist, right? All of your handles. Last question for you, Katie. And thank you so much for your time. And we're just so excited for you and to be a part of this and working with you. But let's say, because this isn't going to happen, but I always use this hypothetical on certain guests. Let's say we didn't talk for the next 5 years and we ran into each other somewhere. What are you going to tell me about the Carefullist 5 years from now?
Oh my gosh. I would say that we have an app that you can use to find what's close to you. I would say that people have found it helpful and that it has saved them time and it has made them realize that even though it's a very lonely journey, they are not alone. And other people have walked this path before them, and people are walking it with them, and people will walk it after them. And so the more we can come together as a community and demonstrate that we are a community, we all have this experience in one way or another. And by supporting that and being there for one another, we can change the way things are.
Yeah.
And so I am really looking forward to 5 years from now being able to say that the Carefullist community has been able to move the needle in how we care for one another.
I think that is perfect. Well, Katie Kristofic, thank you so much for being with us today and for all you're doing to help support family caregivers at the Carefullist and on your own. We're looking forward to watching that journey the next 5 years.
Thank you so much. I appreciate this.
You're
Take
welcome.
care.
Have a good day.
You too. Bye-bye.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Katie Kristofic from the Carefullist for joining us today. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.